Hello, today I will be giving my presentation of the epidemiology, triangle, and history of disease of HIV and AIDS. And it's by me, myself, and I, Destiny Wheaton. So, HIV stands for Human Immunodeficiency Virus. It's an enveloped RNA retrovirus that attacks the body's immune system, specifically attacking those T helper cells in our body. These cells play an important role in fighting the infections that we have in our body. So, as HIV destroys these cells, the immune system in our body becomes weaker, and then it's less able to protect us. If it's left untreated, that's when this disease progresses to AIDS, which is the most advanced stage. So, HIV AIDS, it was first recognized in 1981 when the doctors just noticed an unusual infection occurring in young adults. But in 1983, that's when scientists identified HIV as the virus responsible for the diseases. Research do suggest that HIV originated from a similar virus found in chimpanzees in Central Africa that was transmitted to humans. And then since its discovery, HIV has become one of the most significant infectious diseases worldwide, and it has affected millions of people. So the agent. So the classification is it's a retrovirus, which is enveloped in that RNA virus, which pretty much means that outer bubble layer. So the envelope helps HIV attach to and enter the human cells. So enveloped viruses are genuinely easier to kill with soap, disinfectants, and drying out because the envelope is fragile. So if the envelope is damaged, the virus usually can't infect those cells. And that is spread through blood, sexual contact, mother to child. The virulence factors, which are just traits that help the microorganism cause the disease and survive inside the host. It has a high mutation rate, so that makes it hard for the immune system to see it and destroy it. Latency, so that just means it can lay dormant in our bodies in that cell for years. And again, it destroys those CD4 cells, which are those T helper cells that help fight diseases in our body, and it integrates into host DNA. So the host is honestly anyone that can be infected. People at higher risk is people that have unprotected sex, sharing needles, drug users, people that have untreated STIs. The risk is influenced by healthcare access and immune status. So if you're in a rural area and you don't have a lot of healthcare options, that can affect you. You can be at a higher risk of being sustainable to getting that disease. Hello, today I will be discussing HIV/AIDS using the epidemiological triangle. I will explain the history of the disease, the agent, the host, and just environmental factors that contribute to transmission, and then methods of prevention. This is by Destiny Wheaton. So what is HIV/AIDS? So HIV stands for Human Immunodeficiency Virus, and it's enveloped RNA retrovirus that attacks the body's immune system, and specifically those CD4 T helper cells in our body. These cells play an important role in fighting infections. So as HIV destroys these cells, our immune system becomes weaker and less able to protect the body. So, if HIV is left untreated, that's when it gets to its most advanced stage, which is AIDS. So the history of HIV/AIDS, it was recognized in 1981 when doctors just noticed an unusual infection occurring in young adults. But in 1983, scientists identified HIV as the virus responsible for the disease and the infections going around. So it's suggested that HIV originated from a similar virus found in chimpanzees in Central Africa, and then it was transmuted to humans. So since its discovery, HIV has become, honestly, a very significant infectious disease worldwide, affecting millions of people. The agent. So the classification of HIV, it's a retrovirus, and it's an enveloped RNA virus. And the envelope helps HIV attach to and enter human cells. And the envelope is like the outer bubble layer. And enveloped viruses are usually easier to kill with soap, disinfectants, and drying out because that outer bubble layer is so fragile. So if it's damaged, then the virus usually can't infect those cells. And it's spread through blood, sexual contact, and like mother to child. So the virulent factors, it has a high mutation rate, which makes it harder for the immune system to see it and destroy it. It can lay dormant in the body for years. It can just sit in that cell and be infected and not actually affect your body for years. So that's neat. Again, it destroys those T helper cells that help fight infections in our body. And then it integrates into host DNA. So usually, cells are DNA to RNA, but HIV is RNA to DNA. The host. So anyone can be infected. The host is the organism that can become infected. In the case of HIV, any human can become infected. However, certain risk factors increase like if you can be infected or not, and that just includes unprotected sexual activity, having multiple sexual partners, sharing needles, having other STIs, and then maybe like you don't have access to healthcare or the testing needed, and treatment also plays a role in determining outcomes for infected individuals. HIV is transmitted through the exchange of certain body fluids. The most common methods of transmission are unprotected sexual contact, like I said before, exposure to infected blood, sharing needles during like IV drug use, mother to child, and that includes breastfeeding, but it's not spread through casual contact like hugging, shaking hands, sharing food, mosquito bites, all of that. The environment, that just includes external factors that affect disease transmission. Humans serve as the reservoir for HIV. The virus is found in the blood, semen, vaginal fluids, rectal fluids, and breast milk. Environmental factors that contribute to transmission include limited healthcare access, lack of education about prevention, poverty, the homeless, and just the stigma around actually going to get HIV tested. And those conditions can increase the spread of the disease. So the epidemiological triangle consists of three components. That's the agent, which is HIV, the host, which is any human that is susceptible, environment, which is the conditions that allow the transmission, and then when all three of these interact together, that's when the disease occurs. So prevention, there's no cure for HIV, but there are many effective prevention methods, and that's just including practicing safe sex through condom use, taking preventative medications such as PrEP, which is very well known nowadays, and PEP, avoiding needle sharing, drug use, and undergoing regular HIV testing. And then for Individuals who are already infected, they can do antiretroviral therapy or ART, and that can suppress the virus to undetectable levels and improve your quality of life. Fun facts, or maybe not so fun facts, but over 39 million people in the world live with HIV. Um, it is treatable, like I said before, we just don't yet have a cure. But if it is undetectable, it is untransmittable. So that's why it's important to, take the PrEP or doing that ART therapy and just taking those preventative methods. And then my reference page, HIV remains a major global health issue. Millions of people all over around the world currently live with HIV. Like I said in the last slide, 39 million. But with advanced testing and treatment, we have significantly improved survival rates over the years. Um, and again, important concept in HIV prevention is U equals U. If it's undetectable, it's untransmittable. Thank you. So, the epidemiological triangle. So, the agent is the HIV, the host is any human that is susceptible. I think that's the word I meant to use in the last slide, not sustainable. And then the environment is the conditions that allow the transmission. So, this disease occurs when all three of these interact together. Prevention. So there's no active cure for HIV at the moment, but there are many effective prevention methods. So these just include practicing safe sex, condom use, taking preventative medications such as PrEP and PEP, avoiding needle sharing, and undergoing regular HIV testing. For individuals that are already infected, antiretroviral therapy or ART can suppress the virus, and that can make it at undetectable levels, and that can significantly improve quality of life. And when you're undetectable, it's untransmittable. Fun fact, so over 39 million people in the world live with HIV. HIV is treatable but not yet curable. And again, if it's undetectable, it is untransmittable. And then my reference page, HIV remains a major global health issue. Millions of people worldwide are currently living with HIV. Fortunately, though, advances in testing and treatment have definitely improved survival rates. An important concept in HIV prevention, just like on the last slide, is U equals U. So if it's undetectable, it's untransmittable. So, yes, thank you.